Dr. Nadine Bedalia now. She's founding director at the Boston University Center for Emerging Infectious Diseases Policy and Research, also an NBC News medical contributor. Doctor, thank you for joining us tonight. Let's talk about this isolation period, reduced to 5 days, supposed to help ease the disruptions. Now there's talk of the CDC potentially adding a testing requirement at the end of that. But we know people might test positive weeks after being infected. Do you think that requirement would be prudent?
Yeah, Kelly, I think this is a rock and a hard place. And the CDC really had a hard choice in front of them, right? Because you're seeing that the incredibly unique challenges that Omicron's facing is that this blizzard of even mild flu-like symptoms can keep workers out of the economy. And that's not just the corporations. We're really talking about essential services. We talked about healthcare and schools, but you can also see how this could affect waste, water, food production. And if you really look at the numbers that are predicted of 1 million cases a day, you can see why shorter isolation periods might help return some patients back to work if they're not transmitting. And therein lies the hard choice, right? The CDC initially based their recommendations on the fact that majority of the people who get this virus, the highest level of the virus is right before you become symptomatic and in the few days after. And Dr. Fauci has said that majority of the transmission is within those 5 days. However, everybody's different, and there might be people who might transmit for longer. And I do think that adding that rapid test, that's what's considered. We'll see what the actual recommendations are, and if they're amended, could add an extra level of protection to make sure that workers are not returning to work while they're still transmitting and potentially continuing the cycle, if you will. The trouble, though, Kelly, is are we going to be able to access that many rapid tests? And will there be another choice for workers who are not able to test out?
Yeah, no, so you are open to it, although it would be a logistical issue and obviously at some point a staffing issue for the whole economy. I want to ask you about Florida's Surgeon General today, suggesting that state will use a new strategy to prioritize high-risk people over others in terms of testing. Take a quick listen.
So high-value testing is testing that's likely to change outcomes, right? So, if your grandmother gets a test, that's a much more valuable test than the 8-year-old, third graders that Los Angeles County is sending in to get weekly testing, right?
Do you agree with that approach?
Well, we don't all live in different society. Unfortunately, our grandkids live sometimes in the same homes as the grandparents, right? I think that in the current surge period, actually testing is important because there's so many connections between all of us. That's in a perfect world. If you don't have enough testing, of course, you want to try to target those for whom you could get access for medical treatments. But hopefully we don't get there. What we want to do is reduce the cases so we can protect the vulnerable. You are seeing benefits now with Omicron potentially being a slightly less severe illness, but people who are unvaccinated are still going to be heavily affected.
They are. Dr. Bedalia, thanks for your time tonight. We hope to check back in soon.